the ANCC versus the AANP, I tell people to really focus in on how your study style is, your learning style. With the ANCC, people think that it's going to be more difficult because it has more factors, it has a lot of the non-clinical components. And I said, honestly, it's not that one is easier than the other, but what fits best for you. Both of them, you are credentialed the same throughout. A lot of people have gotten the idea that the ANCC is better, but the only thing is the ANCC was out first. So a lot of organizations are more familiar with the ANCC, and so that's why they commonly gravitate towards that in some spectrums, but they're the same. You are credentialed equally from either board that you take, so don't sit there and make a decision based upon thinking one is, more highly looked at versus the other. So that's not one of those things. But when you sit down and look at what the test truly offers, they have changed in 2019 of May, like 22nd or so, they changed the exam. So the ANCC, that's the one that has now 175 questions. You have 3.5 hours to take the exam, whereas the AANP has 150 questions and you have 3 hours to take this exam. Now, on the ANCC, they have non-clinical and clinical questions, but this exam is predominantly non-clinical. And I mean, like 65 and greater percent of the exam, yes, is non-clinical. And so some people ask, what does non-clinical mean? That's your culture, your research topics, your ethics, your Medicaid versus Medicare, your billing options and things of that nature. So they do highly look towards those questions, I should say. But I want you to understand that they do put clinical content in there. So although it may be non-clinical in the question format, it's still clinical, so to speak. And to elaborate on that, like, for example, they may say, it's an Asian 45-year-old lady that comes in, and then it starts to go into hypertension, diabetes, or whatever else they may have going on. So you're still having to do the clinical aspect, but it also wants you to think and identify on the cultural aspects of how Asian populations may like to treat and, manage their care. And so they kind of merge the two, so it can go both ways. So that's how the ANCC is. But I also say, I am a visual learner, so I said the ANCC worked well for me because they offer multiple testing styles. So you're going to get the multiple choice questions, you're going to get the drag and drop questions, you're going to get those hot spot questions, which are like click here on the image, etc. And you're going to get select the best 2 or select the best 3. So I feel like those who learn better, who are visual learners and things of that nature, this may be a better exam for you just because it gives you a variety on your testing style. So you're able to look at the image and click on those if you're visual, and then select the best 2 and select the best 3. When we come from the NCLEX, we get so overwhelmed with the select all that apply. But I think this is a little bit better because, when we have NCLEX, it's like select all that apply. You don't know if I need to select 1 or all 4 or none of these, But with select the best 2 or 3, it's specifically telling you exactly how many answer choices you need to select. So I think that's a huge help. And I've seen, like, when I work on that with my review students, that they find that very helpful. Whereas with the AANP, it's strictly all multiple choice questions. People have the idea that on the AANP that there are no non-clinical questions. There are some, again, as I mentioned earlier, that they may be incorporated with some of the other question styles, so you don't realize that it's truly a non-clinical question, but it is looking at that non-clinical content. But overall, it's all multiple choice questions for that exam. So just pick what works best for your learning style so that you're able to apply the knowledge you have for those test questions.